Collecting a blood sample typically involves the following steps. Gather necessary supplies. You will need sterile gloves, an alcohol swab, a tourniquet, a blood collection tube, a needle, adhesive bandage, and a biohazard bag. Prepare the patient. Ask the patient to sit or lie down and prepare the patient arm comfortably. Inform them about the procedure and ensure they are relaxed. Locate a suitable vein. Typically, the vein in the inner elbow or back of the hand are used for blood collection. Apply a tourniquet a few inches above the intended site and ask the patient to make a fast. This helps to increase the visibility and accessibility of the vein. Clean the area. Use an alcohol swab to cleanse the selected site on the patient's skin. Allow it to dry before proceeding. Prepare the equipment. Put on sterile gloves. Attach the appropriate needle to the blood collection tube. You may need to assemble the needle and tube if they are not pre-connected. Insert the needle. Puncture the vein by pulling the second dot below the puncture site. Insert the needle smoothly and swiftly into the vein at a slight angle. Look for a flashback of blood in the collection tube indicating that the needle is in the vein. Collect the blood depending on the required volume, release the tourniquet and adjust the angle of the needle slightly. Blood should flow into the collection tube. If the multiple tubes are needed, switch them are required, ensuring the tubes are properly labeled. Remove the needle. Once the blood is collected, remove the tourniquet and withdraw the needle from the vein. Apply gentle pressure on the puncture site using a clean cotton ball or sterile gauze to stop any bleeding. Square the site. Apply an adhesive bandage or sterile dressing to the puncture site. Instruct the patient to apply pressure on the bandage for a few minutes to aid in clotting. Dispose of the materials. Place used needle and tubes in a biohazard bag or sharps container as per your local regulations.